Hello, everyone. Welcome back to Kicking It with Kids. And today we will be delving into a very interesting subject, and it is about the different perceptions about mental health. And this really is pertains to our generation because mental health awareness and mental health itself are becoming more on the rise. And we're just here to see the different perspectives on mental health. And with this podcast, I'm Krish.
I'm Ashna.
And I'm Simran. Today we have a very special guest.
Hi guys, I'm Dr. Swati Varshney. I'm a clinical psychologist and I'm going to try and help kind of answer some of the questions you all have.
Thank you for joining us today.
Yes,
You're
I want
welcome.
to start off the podcast with just saying, what are some of the common misconceptions about mental health? Because I know, like, when I think of like depression, I think of like someone being sad, but that might not be like the full understanding. So I wanted to ask you, what are the common misperceptions?
I think that's a good question. I think what we see, number one, is a lot of people tend to kind of base their perceptions on something they've seen, they've heard, which may be accurate and most times is not accurate. So you'll see that there is a huge stigma that's associated with reaching out for mental health services. You'd be surprised that in the United States, it's usually about every 1 in 5 people has some kind of mental health issue. It can range from mild to severe, but what's shocking is that just about 40% of them actually seek care. So I want to hear from you guys, like what you said. If you see somebody sad, you think they're depressed. What are some of the other things that the rest of you've seen or, come in contact with, anybody who you feel has had these issues in the past?
I know I had a friend who was OCD, but when she first told me that, I was like, oh, so like you're really like picky about stuff and like you want everything to be like perfect. That's what I thought. And then she actually explained it to me and I was like, oh, that's definitely like not the full like thing.
So what you commonly see people saying, unfortunately, these terms have become almost kind of labels. People use like, oh, she's OCD. Oh, she is, she's crazy. She's this, she's that. And that kind of shapes our perception about what we perceive mental health to be. Another example is if you have some kind of a physical illness, right? So let's say if somebody has heart disease or somebody has a developmental disorder, you usually don't kind of stigmatize that part. You say, oh, okay, she has heart disease, but she needs care, so she's going to the doctor. But more often than not, when you see people saying, oh, I don't know if I can go on medication or if I can go seek help, a lot of fear, a lot of fear of rejection, a lot of fear of judgment. And I think that what prevents people from seeking care for years. So we see a lot of patients who have struggled for a number of years, but wait for a very long time till things become so overwhelming that it leads to severe symptoms. And that's when, we get to see them. So let's start with kind of debunking some of the common myths that, that I've experienced or you will commonly see. The number one myth is you're either mentally ill or you are mentally healthy. There is no, one versus the other. Usually mental health is a continuum. So you'll see that people can fall anywhere on a spectrum. Like what you said, Ashna, somebody's sad. That means they're depressed. It doesn't always kind of, so it's almost think of like a rating scale on a 1 to 100, where 1 would be, oh, I got upset today because, probably I didn't get what I wanted, or I got a low grade, or, it's something that's more situational can be fixed easily to somebody isolating themselves, thinking about suicide. That would be major depression. So it's always a continuum. All of us fall somewhere on that continuum. I don't think there's anybody who would say, I don't feel sad, or I don't feel upset, or I don't feel anxious, right? So that is one of the biggest things. You're not always 100% mentally healthy. Do you know what that means? It's not that somebody who's happy all the time cannot be depressed, right? So those are the things kind of to look for. I think when you talk to friends, when you talk to family, a lot of people don't really confide or tell you what's happening because they want to project a different image, right? For the same reasons.
Yeah, I
Does
know
that make sense?
Yeah, a lot of the time I know like seeking help or even talking to anybody, especially about mental health, is perceived as like weakness or you're not strong enough to handle it on your own,
Yes.
which I think is so almost crazy to think because our mental health is in a sense part of our overall wellness. So just like our physical health, we go to a doctor, we go either have surgery or go on medication or whatever it is. Why isn't our mental health perceived the same is kind of something that is also very curious personally, but I know as a generation we're kind of raising awareness about mental health and beginning to break that stigma almost because it has become so prevalent in our age group, particularly like teenagers in this day and age, due to whether it be college stress or just external pressure. So I think it's really important that we're like understanding what mental health truly is, because like you said, it's becoming a label of, oh, I see someone sad, so they must be depressed, or even someone just being like, I'm like stressed, maybe I have anxiety. And like it's so much more than just the stress or the sadness that we see all the time. So there's like a difference between like day-to-day sadness versus a sadness in an extreme to where it does need to go, do need to go seek help or go on medication.
True. Yeah, I think mental health, what I think you kind of hit it right there, is seen or perceived as a sign of weakness. And that is why you'll see a concept that's out there now. It's called mental strength. I don't know if you guys have heard about that, but that basically means that many people who struggle with mental health issues can still be mentally strong, right? It means that somebody who struggled with depression or somebody who struggled with anxiety for a very long time, you'll see there are so many of them that are successful, who are out there, so many celebrities that you probably, see every day, hear every day now as the awareness is rising. So this concept of strength is important because somebody who's experienced this in the past does not mean that, that's the end for them. It was a perception in the past, and still you'll see that with a lot of people, is that you can't prevent mental health, right? If you get some kind of diagnosis of depression or anxiety, it stays with you forever. And that's not, you all know, that's not the truth. It all depends on who you surround yourself with, what kind of treatment you seek, and how consistent you are with following through, and you can kind of come through that with the right coping skills, right? The other big misperception, thanks to a lot of the media hype and the movies and things that you see, is people with mental health are violent, right? You'll kind of feel scared of them. You think that the person is going to behave like somebody out of the movies, coming after you with a dagger. So it almost kind of boils down to that when you see things like mass shootings, right? The way it's portrayed, or you see a lot of instances of domestic violence where it almost kind of draws a correlation. But even though there is a small percentage of people with mental health who may be violent, there is a huge percentage of people who are actually the victims of that violence. So it's the opposite. So you'll see more people who are mentally ill or have any kind of mental health issues become victims of such kind of violence. So that was one more thing that I wanted to kind of put out there.
Yeah, I know, because a lot of the times when you think of someone that has mental health problems or a mental illness, whether it be depression, anxiety, schizophrenia, PTSD, OCD, bipolar disorder, you think of them as, oh, they're crazy. Like that's the immediate label put on someone with any mental health issues, which is insane because, like you said, mental health is a spectrum. Like it really varies, and every single disorder is so different. It's crazy how we label all of them as crazy people, or they're insane, or they're psychotic. And I feel like we are starting to stem away from that, but the media does put such a pressure on, for example, in the Parkland shooting, the shooter, who was 19 years old, he was a teenager, he suffered from depression and anxiety. And that was such a point. They were like, oh, he shot up the school because of this, because of this, because of this. And um, it was really broadcasted that he suffered from mental health issues. And that is only, they, I assume they were trying to kind of raise awareness in a sense where it could have been proactive to possibly help him earlier to stop this. But in the end, it ended up almost adding to that stigma of people with mental health issues are violent or crazy or anything like that.
Not just that. I mean, if you just turn on the evening news every day, if you see people who've been arrested or who, are being presented in front of the judge, they will have a mental health history or a history of psych issues. And then it automatically kind of correlates to them, everybody who has that will end up, doing stuff like that. So.
Yeah, for sure.
I want to add that also self-diagnosis of mental is also a big issue, because I would see people at school who were very social, but then like to kind of draw attention to themselves, they would say, oh, I have social anxiety. Like I can't go there. Like I can't be on that side of the room. Like I have to sit here. Like, but then at lunchtime, they'd be like talking to everyone. So, I mean, they didn't go to the doctor. They didn't want to ask their parents for help. They just assumed like, oh my God, like I just don't want to talk to these people. So I like have social anxiety. So what do you think is kind of the line between like thinking like you have a mental illness or you don't have it?
So there's always, two sides of the coin. There's always people who will try to take advantage of the situation, right? There'll always be people who, and that's, that's a whole another series you could possibly do about personality disorders and, how people tend to develop those behaviors and attention seeking and all of that. But I don't want to take away from the main message where, if you see something, if it stands out, pay attention. Because if it's happening more often than not, there probably is a problem there. So going into what you asked, Ashna, when to ask for help, right? So what is normal, what is abnormal? So you will see that, what Simran said, there are so many kinds of disorders, right? There's anxiety disorders. So your typically things like your obsessive compulsive disorder, your panic disorders, phobias, anything that involves an exaggerated response, where you get really anxious, really fearful, falls on that spectrum. Your depression kind of takes care of things like major depression, bipolar disorder, things like that, post-traumatic stress disorder, where somebody who's experienced a significant trauma in their lives. As we're seeing right now with the situation happening, with COVID and so much of uncertainty, there are so many families who are experiencing a new sense of loss, which they have probably never experienced before. Losing family members, losing relatives, a lot of anxiety, a lot of fear, which we are seeing every day when we are seeing patients who either get diagnosed with it or are put in isolation. And again, it's the spectrum. It can range from very mild to the very severe, right? You have psychotic disorders which is typically schizophrenia, which I think most of you kind of associate with being psychotic, right? Like you said. The important part, I think, is always to remember to look out for a couple of indications. The number one thing that you look out for, are your symptoms severe enough to interfere with your everyday functioning, right? It means that, are you constantly having so much anxiety that you can't concentrate on anything, right? Are you kind of being able to manage your emotions at school? So what you said, somebody's socially anxious, they're fine 1 minute, but the next minute, just because it suits them, they say, oh, we are socially anxious, we can't mingle with a group of friends, right? That rarely happens. You'll see those symptoms kind of be similar across situations. You will see a gradual decline in your productivity, where because you can't focus and you don't know how to manage your emotions, it'll start to have an overall impact on your functioning. So that is what will dictate when it becomes from, let's say, situational or mild to where you need to start paying attention and ask for help, right? The other thing that you can look out for is, does your mood feel off, right? Now, that's an easy one to kind of misconstrue, because everybody's mood is off, right? How many times do you say in a day, oh, my mood feels off, I don't want to talk to you, or my mood feels off and I don't want dinner, or I don't like what mom cooked for dinner, so my mood is off, you know? Or you don't get to go to your favorite friend's house and you're like, oh, my mood is off. Does that mean, are you mentally, you know, having an issue? Does that? So it's kind of a challenge right there. What it really means is, if your mood issues last consistently for more than 2 weeks, right? So usually a diagnostic criteria is when your symptoms last over 2 weeks, where you've been sad, you've been isolating in your room, you can't focus, you don't want to talk to anybody, you don't feel motivated to do anything. For children, it can be as long as 6 months, right? So for teenagers, for young adults, when you are having that over that period of time, it changes from being normal or mild to abnormal, right? Does that make sense?
Yeah.
Yes. And let's say one of my friends, like, she was going through this, but she didn't notice it herself. How would it be like a good way to reach out to her, or like get her some help if I can see that she's going through something?
So there are some other indicators. The number one thing is sleep. I know we kind of take sleep for granted, a lot of us, because, you know, especially now, you kind of have your own schedules because everything's online. But sleep habits dictate a lot to do with your mental health, well-being. I'm sure you've heard this, you know, over and over again. Whether you have sleepless nights, where you have a lot of instances of insomnia, you can't go to bed, or you are sleeping excessively, those would be things where you can reach out to your friend and ask, you know, hey, what's happening? You keep telling me that you're up really late, you can't go to bed, or you're sleeping a lot more than how much, you know, I know you usually sleep. And both those things can be usually a red flag, where you can start to ask more questions. In teenagers, especially, weight is a huge thing. I'm sure you guys have all run into this. But when there is a significant weight loss or a significant weight gain in a very short period of time, that can again have some kind of, it's a signal towards your mental health. So your physical health also is kind of tied into this whole thing, right? What you'll see is people having an unusual number of headaches or an unusual number of stomach aches. Of course, you go to the doctor and you rule out any physical causes for what you're having. More often than not, you'll see it's related to something going on related to their psychological well-being. Has any of you run into that with a friend, or, you know, seen that before?
Yes.
Yeah, I know at least at my school, stress migraines are extremely common,
Mhm.
whether it be in class or during like test taking anxiety or anything like that. Stress migraines, stomach aches, nausea
Mhm.
are all very common. Not eating is also very common, maybe when you're
Yep.
super stressed during lunch and you have a test next period or something, you're just like, it's okay, I don't have to eat. Like, it's fine. But like in reality, you do have to
Mhm.
nourish your body. You do have to keep your energy up, and that
Yes.
is more beneficial than cramming for the test. But it becomes
Mhm.
a cycle of we go many days without eating or things like that.
Yeah.
And it's hard to bring it up to your friend because, like we were saying earlier, um, a lot of people and societal pressures have labeled mental health or mental struggles as a weakness. So even saying that, they're like, no, I'm not weak. Like, it's fine. I can handle it on my own. So how do you suggest, like, one, convincing someone to go get help because they have to break that stigma
Mhm.
within themselves of mental health as a weakness?
So a lot has to do with recognizing those signs. I think it's important, especially if you know somebody, if like what you said, you know somebody who's your friend, somebody's behavior who you watch day to day to day, and you see that something's off, right? It's always a good idea to kind of sit with them and say, hey, I just want you to know if there's anything happening, I'm here, and I can help kind of talk to you. Um, it's hard to push people towards seeking help because a lot of people would shut down or back away, but believe me, when they know that you're out there to give them that support and not necessarily judge them, they will seek you out when they need to talk. um, the language that a lot of people use is important. Uh, if you know of somebody who's had psychiatric issues where it's gotten severe, or it's important to be sensitive to how you say that, because a lot of people instantly would shut down when they hear the wrong word, right? So that stigma kind of, they tend to relive that with the way you bring up the topic. Um, Besides that, I think the number one thing that you guys, I think, have been concerned about, or what you see, is the number of suicides that are happening with the younger population now, right? Um, Suicide is, of course, one of the top leading causes of death in the United States. Uh, have you ever come across a situation or felt that you needed to talk to a friend? Has anyone of you ever experienced any instances where you felt, oh, maybe I could have done that?
Um, I know for sure I've had people around me that have taken their life due to suicide, whether it be family members or friends at school. Most recently, like 2 weeks ago, a student at Stanton took their life um, due to depression. And it's, a lot of people felt as if they could do more, but it's really hard to notice in those people that are super charismatic and extroverted. And I know Krish has also had like experiences of friends with like depression who've had suicidal thoughts, if you want to add on that.
Yeah, I mean, I've definitely had experience with people who have, of course, had a little bit of trouble with their mental health. And yeah, but um now that we've talked a lot about how to recognize mental health, I think that we should talk about how to sort of some ways we can improve our mental health in some way.
Right, right. So what you see, Chris, typically is when you hear about these things, or you see a friend kind of getting turned towards what we say is maladaptive coping mechanisms, where they resort to drugs or they resort to alcohol. Um, it kind of leaves you wondering what just happened, because this was a person that you say I thought was super charismatic. What just happened here, right? So it's important to kind of reach out for help. There are a number of resources. I think we've moved, I know there hasn't been enough progress where I would like to say that, yes, we're doing a fabulous job of taking care of people's needs. But I think we've come a long way where there is a lot of resources out there that, you can help kind of channel people towards. We have, I think all of you have counselors at school, right? And I think they're more and more kind of involved in your well-being. It's not just when, one instance happens and you have to go seek the counselor's help. If you feel at any time that there is something going on that you need to talk to someone, I think that's a good place to start, because they understand you in the school environment. I think they understand where most of your stress might be coming from, at least for the majority of the students. And so that would be a good point to start at, right? I think counselors are, even now with COVID, I think I just received an email from, my kids' counselors at school, even though they're distance learners, that if there is anything that they need to talk about, they can even set up Zoom sessions. So I think one beneficial thing that's happened with this is that you can do a lot of telehealth services now. And you'd be surprised how many mental health providers are right now providing telehealth services, where you can actually reach out, have a consultation with them, and kind of see, what's going on. Do I need to kind of take a step back? Do I need to see what do I need to change? Or if you need, ongoing help, then kind of approach it from that standpoint, right?
I wanted to kind of go into what do you think, in your words, what is mental health?
Mm-hmm.
Because I know everyone kind of has a different definition of mental health based off of their experiences. So for you, what is mental health for you?
So mental health, Ashna, would be more of having a good sense of psychological well-being, where you feel like you have the ability to cope with things that come your way, right? Like I said, it is a continuum, so it's a spectrum of things. Ultimately, it boils down to what makes people mentally strong, right?
Yes.
You can be anxious, but you can still have the ability to cope with those stressors. And that's what sets you apart from somebody who's never experienced that stress in their life, right? So for me, I think it's important. I don't think it's realistic to say that you live in a utopian world where you will never experience any anxiety, any depression. You will always have some kind of stress in your life, So it's important to understand what makes us resilient, right? And how we can cope with not feeling overwhelmed all the time, being able to function and do things that we want to do, and yet find a way to kind of feel balanced, right?
Yes. So with that being your definition for mental health, what would you say your definition for mental illness would be?
So again, the mental illness part of it, and I usually, it's interesting you bring up that. You know what day it is today? It is Mental Illness Awareness Day. So I think you're doing this on a very apt day. It's this whole week till October 10th is Mental Illness Awareness Week. So mental illness, again, is something that people struggle with. It becomes an illness when you are constantly going through the same cycle over and over again, and you're unable to kind of break free from that, to a point where it's impacting different parts of your life. It could be social life, it could be your occupational life, right? Things that you do, the ways you function, and gets to a point where it can become part of a clinical symptom or a syndrome. And then, of course, there are ways to kind of classify and diagnose that. But that is, probably the next step. But what you need to know, if something's happening over and over and over again, and it's not letting you do things what you think you could do in the past, right? Or it's something that's preventing you from doing what you know you can do best, I think it's a good time to kind of sit and talk to somebody who you think can kind of help you through that. If you know people in the community, if you know people in the family, if a lot of you are not comfortable talking to your parents, seek out somebody else in the family that you can strike a conversation with. And I think that would help you greatly.
I think that is a really good place to stop. But before we go, what do you think is the best way to raise awareness for mental illness?
Mm-hmm.
There is such a stigma around it. So
Mm-hmm.
how do you think we, being teenagers, could raise awareness?
Okay. I think a big part of that is educating yourselves, right? And I think the three of you have come a long way, where at least you've taken the first step, where you recognize that there is a problem, that there is something that needs to be kind of, maybe you need to educate your friends, you need to educate others around you. So kind of get yourself more knowledgeable about what these things might mean. I think this is a great first step, where you're trying to kind of understand how things progress, what can be considered just normal stress, anxiety, depression, or to look out for people who are going to harm themselves, right? So education is key, knowledge is key. The other things that you probably can do is you can kind of coordinate with some physician offices or practices where you can do screening questionnaires. I'm sure the counselors probably do that in school. You can coordinate something in your school where you can do a screening questionnaire and see, how many people actually give you or reach out for help based on those screeners, to need help with anxiety or depression or other issues that they might be kind of experiencing. So I think those are all good points where you all at this point can kind of help initiate those measures.
Yes.
Well, thank you for joining us today. We've had a very beneficial talk, in my opinion, regarding how we can begin to break the stigma of mental health that society has created, and how to bring awareness to the realities of what a lot of kids in our generation are experiencing. Make sure to subscribe and follow our Instagram so you can be updated on our new episodes. Bye.
Thank you. Bye.